I'm going to take you through the anatomy of the spleen. So this is a spleen. It is a lymphoid organ connected to the blood vascular system. It acts as a filter for the blood and plays an important role in the immune response of the body. So the location. So the spleen, it is a wedge-shaped organ lying mainly on the left hypochondrium and partly in the epigastrium. It is wedged in between the fundus of the stomach and the diaphragm. The spleen is tetrahedral in shape. The spleen is soft, highly vascular and dark purple in color. So this spleen, it is 1 inch thick, 3 inch wide, 5 inch long and 7 ounce in weight, and it is related to 9 to 11th rib. The spleen has two ends, three borders, two surface, two angles and hilum. So this is the anterior end. It is expanded and it is more like a border, whereas this posterior end, it is rounded. It rests on the upper pole of the left kidney. The anterior end is also known as the lateral end and the posterior end is also known as the medial end. Then it has three borders: a superior border, an inferior border, and intermediate border. So the superior border, it is notched near the anterior end, and the inferior border, it is rounded, and the intermediate border, it is also rounded and directed to the right. It has two surfaces. This is the visceral surface. It is concave and irregular, whereas this is a diaphragmatic surface. It is convex and smooth. So two angles. One is the anterobasal angle, another is the posterobasal angle. So the anterobasal angle is found at the junction of the superior border with the anterior extremity. It is the most forward projecting part of the spleen, whereas the posterobasal angle, it is found at the junction of the inferior border with the anterior end of the spleen. Next is the hilum of the spleen. It lies between the superior and the intermediate border. The peritoneal relation of the spleen. So the spleen, it is surrounded by the peritoneum and it is also surrounded by ligaments. So it has a gastrosplenic ligaments, a Lino renal ligament and a Phrenicocolic ligament. So the Phrenicocolic ligament, it is not attached to the spleen but it supports its anterior end. Now saying about this gastrosplenic ligament, it extends from the hilum of the spleen to the greater curvature of the stomach. It contains the short gastric vessels and associated lymphatics and the sympathetic nerves. So next is the Lino renal ligament, that is from the spleen to the kidney. It extends from the hilum of the spleen into the anterior surface of the left kidney. It contains the tail of the pancreas. Then there will be splenic vessels associated with the pancreatico-splenic lymph node, lymphatics and the sympathetic nerves. Next is the Phrenicocolic ligament, that is from the diaphragm. This is a diaphragm and this is the colon. Actually it is not attached to the spleen but it supports its anterior end. It is a horizontal fold of peritoneum extending from the splenic flexure of the colon. This is a splenic flexure of the colon to the diaphragm, opposite the 11th rib in the midaxillary line. So now talking about its visceral relations. The visceral surface of the spleen, it is related to the fundus of the stomach, the anterior surface of the left kidney, the splenic flexure of the colon and the tail of the pancreas. Actually, this is the intermediate border, not this one. There was a slight mistake. So this is a superior border, this is the inferior border, and this is the intermediate border. So this is the gastric impression for the fundus of the stomach, and it lies between the superior border and the intermediate border. It is the largest and the most concave impression of the spleen. Then we have the renal impression. So this is a renal impression for the left kidney, and it lies between the intermediate border and the inferior border. Then we have the colic impression for the splenic flexure of the colon. It occupies a triangular area adjoining the anterior end of the spleen. Then we have the pancreatic impression. Pancreatic impression for the tail of the pancreas. It lies between the hilum, this is a hilum, and the colic impression. So it will be here. Then we have the hilum. This is a hilum that lies on the infromedial part of gastric impression. So this is a gastric impression, infromedial to gastric impression along the long axis of the spleen. This is the diaphragmatic surface. It is related to the diaphragm, which separates the spleen from the costo-diaphragmatic recess of the pleura, lung, and the 9th, 10th, and the 11th rib of the left side. Now coming on to the arterial supply. So the spleen, it is supplied by the splenic artery. So this is a splenic artery. It is the largest branch of the celiac trunk. So this is a celiac trunk, and it is the largest branch of the celiac trunk. It actually passes through the Lino renal ligament to reach the hilum, where it divides into 5 or more branches. So these branches enter the spleen. To supply it within the spleen, it divides repeatedly to form straight vessels. And those straight vessels are called the penicilli, which further divides into ellipsoid and arterial capillaries. So the further course of the blood is controversial. So there are two theories behind it. One is the closed theory, and the another is the open theory of splenic circulation. Some believes in the compromise theory. So according to the closed theory of the splenic circulation, the capillaries are continuous with the venous sinusoid that lies in the red pulp. Whereas according to open theory of splenic circulation, capillaries end by opening into this red pulp, from where the blood will enter the sinusoid through the wall. Whereas some other believe in the compromise theory, where the circulation, it is open in a distended spleen and it is closed in contracted spleen. So on the basis of the blood supply, the spleen is said to have superior and inferior vascular segments. So talking about the venous drainage, the splenic vein is formed at the hilum of the spleen, and it goes and joins with the superior mesenteric vein behind the neck of the pancreas. Actually, this is a pancreas. Here is the neck of the pancreas, and it forms the portal vein. So its tributaries are the short gastric vein. Then we have the left gastroepiploic vein. Then we have the pancreatic vein. This is a pancreatic vein, and we have the inferior mesenteric vein. Now about the lymphatic drainage. The splenic tissue has no lymphatics, but a few lymphatics. It arises from the connective tissue of the capsule and drain into the pancreatico-splenic lymph node situated along the splenic artery. Talking about its nerve supply, the sympathetic fibers are derived from the celiac plexus. They are vasomotor in nature. They also supply some smooth muscles in the capsule. Now about the function of the spleen. It has a role in phagocytosis, then hemopoiesis, immune response, and storage of RBC. So, in phagocytosis, the spleen it is an important component of the reticuloendothelial system. So, the spleen phagocyte include the reticular cells, modified reticular cells, and free macrophage. The hemopoiesis. Spleen it is an important hemopoietic organ during the fetal life. And lymphopoiesis it also continue throughout the life. Then about immune response. So under antigenic stimulation there occur increased lymphopoiesis for the cellular response and increased formation of plasma cell for the humoral response. In the spleen, the RBC can be stored in the spleen and it can be released into the circulation when needed. So now about the applied importance. We can palpate the spleen. So when the spleen gets enlarged, it can be felt under the left costal margin during inspiration. Splenomegaly. When the spleen gets enlarged, it is called splenomegaly. Then splenectomy. When the spleen is surgically removed, it is called the splenectomy. The spleen can be punctured through the left 9th or 10th intercostal space in the midaxillary line using a lumbar puncture needle. That is called the splenic puncture. Finally, about the development of the spleen, it actually developed from the mesoderm, the dorsal mesogastrium, its cephalic part, the left layer. So details of the dorsal mesogastrium I will be explaining in the development videos. So that's all. Thank you.